In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking too much of your time. Today, we're really excited to be talking to you about the upcoming National Black Nurses Association's Black Maternal Health Virtual Conference with our special guest, Dr. Kamila Barnes. This is part of our maternal health series that we started this season. We're in season 2. In our first episode, we gave a general overall view of the current state of maternal health, particularly as it affects Black and Brown communities. Then in our second episode, we sat down with Alexandria Von Poe, who's a doula, who taught us about the training and history of doulas, and she put a lot of emphasis on the National Black Doulas Association. In May, when we return for season 3 during Nurses Week, we'll be sitting down with Faiza Farole, the founder of the Federal Way Birth Center, which happens to be the first freestanding community birth center in the state of Washington, owned and operated by a Black midwife. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain and understand information and then take that information to manage your health at home. By watching this show, we hope you feel empowered to ask questions, that you're educated on how to manage your health, and that you're confident to navigate the healthcare system for yourself and others. If you haven't already, please subscribe so you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. It shows YouTube that this show is valuable, and it helps get the information to those who really need to hear it. As a reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone might be having a mental health emergency, you can call 988. Well, let's get started. Welcome, Kamila, Dr. Barnes. So lovely to have you.
Thank you, Dr. Madison.
Before we get into the conference, tell us just a little bit about your nursing journey and your relationship with the National Black Nurses Association.
Great. So I started off my nursing journey at SUNY Binghamton University, Decker School of Nursing. And I did the traditional bachelor's program there. And then I came back to New York City to work for a couple of years in the hospitals in med-surg. I also did home care visits and worked primarily with adult and geriatric populations. And then I decided that, I saw myself more in the community. I've always been involved with community-based organizations and also even campus life, always been involved with student organizations. And so my mentor, who's current president of MBNA, who's Dr. Sheldon D. Fields, was my guidance and during that time in making the decisions and pivoting my career, and encouraged me to pursue my DNP, which is Doctor of Nursing Practice. So I embarked on my journey at the University of Rochester School of Nursing and completed my master's there in family nurse practitioner, and then continue on to complete my doctorate. And in my doctorate study, I work with teen mothers in inner city Rochester. And I did a lot of work in the community, engaging in the community resources for mothers in general, but primarily underserved communities. And also I was fortunate to complete an adolescent medicine fellowship at Golisano Children's Hospital, working in adolescents, and also, engaging with the teen tot clinic that they had there, and also get my first NP job, which is working in an adolescent health agency in Rochester as well. So then after I completed my doctorate, I moved back to New York City, and I've been working primarily, and, initially I worked primarily as a clinician and for Northwell Health and for school-based health centers under their pediatric department and adolescent medicine, specifically division. And at some point I started, teaching adjunct. I did start teaching adjunct in my graduate studies, but then I taught adjunct continuously later on after I got my feet wet with being a clinician. And teaching undergraduate students, nursing students, graduate nursing students eventually became a a professor full-time, and the family nurse practitioner director at Long Island University Brooklyn campus. And then I saw an opportunity and I came over to Hofstra University for the School of Nursing and over their undergraduate program at this time. So this is where I'm at with my nursing career.
Very highly credentialed. I found it really interesting that you started with adults and gerontological care, with medical term for older adults, and then you shifted.
Yes. You know, it's funny because, you know, you never know where life is going to take you. And I know when I was in high school and I was aspiring to be a nurse, I said, oh, I'm going to work in labor and delivery. And that's the only aspiration I had. And I said, I'm just going to become a nurse and work in labor and delivery until I retire. But life took me on a different path. And I, you know, was working with teen mothers, the reproductive health services, and you know, the DNP work really ignited my fire in advocating for maternal child health in general, and specifically working in maternal health, advocating for safer births, for better reproductive health care, for access to care, and different things like that, and just getting involved on the policy aspect of it as well. So I if I had to do it all over again, I would. And I'm happy where I'm at today. And also I'm working in my purpose.
Oh, I love that. And I love that you have a mentor, because I ask a lot of aspiring nurses and nurse practitioners if they have one, and most of the time they say no.
Yeah.
And so if you could real quick, what is your kind of pitch for why nurses should have a mentor?
So I have more than one mentor. I'm part of also Chi Eta Phi Sorority Incorporated. I am the immediate past president of Theta Chi chapter, which is the local Queens chapter here in New York City. So I have I have a couple of mentors, and they've guided me in different aspects of life, because nursing school does not teach you a lot of things because they can't. The curriculum is jam packed to just get you to become a nurse. And then if you want to become an advanced practice nurse, you know, you're packed with clinical hours and lab and seminar and all those different things. You know, life circumstances can't be taught in the concept of a program. So having mentors is so critical. Number one, you can't be who you can't see. So that's the first part. And that's why, you know, with National Black Nurses Association, they have a mini nurse academy. They want to mentor little girls, little boys to be what they can see. So we have men's health initiatives. They engage with boys in the barbershop, with grown men in the barbershop, talking about men's health. So we cover every aspect of the community, every facet of the community. And so in regards to mentorship in nursing, you know, these are trailblazers. These are people who've been down your path, who, you know, they may even say, oh, you know, you may get overwhelmed with starting a family and making certain choices about your career path, right? So they can help you with that, you know. So I think I would choose a lighter road, right? I will always go for the lighter road. So if I have somebody who can guide me every step of the way with decision making, also we've done in our chapter with Greater New York City Black Nurses Association. We even have a finance committee that does financial literacy for nurses, because they don't teach us about money. And you may want to run a business one day or go do something that you're passionate about. So we cover all aspects. So, and that's the foundation of nursing. Nursing is a holistic approach to care. So not just medical interventions, is psychosocial health, is mental health well-being, spiritual well-being. You know, we cover every aspect, every facet of a human being.
Beautiful, beautiful, beautiful. You are Black history in the making. So you kind of touched a little bit. Do you want to elaborate more on the history of the National Black Nurses Association?
Yes. So the National Black Nurses Association technically started in 1971. That's our history, but and founded by a group of Black nurses. One of the nurses that was part of the steering committee was Dr. Lorraine Sams. But prior to that, there were other nurses like Dr. Betty Smith Williams and Barbara Johnson, who came together and formed Black Nurses Association chapters in the Bay Area. And so they cover pretty much LA and San Francisco, which is where we're going to have our next national convention, bringing it home. So this is at the end. You have to think about the times that they were in, and at the end of 1960s. civil rights movements was going on. That was the primary focus. But on the nursing end, there were a lot of issues that they observed. Number one, health issues in the community, access to care, health problems in the community. I know a lot of people know about medical apartheid, and they hear about the famous, like research trials and that marginalized communities of colors and were pretty much inhumane. But there were so many issues going on overall and as health-wise in the community that nurses see that there needs to be some association to address this. In addition to that, there were professional issues going on. Black nurses were, excluded from organizations, white nurse organizations such as the American Nurses Association, so that's the ANA. And so over time, Chi Phi was prior to the formation of MBNA, but prior to that, there was still like very slow movement on incorporating Black nurses and recognizing us in the profession. So there were Black members in the ANA over time, but they weren't the priority. And also the health issues in the Black community was not the priority. So this gravitated towards them formulating the chapters, creating the chapters in the Bay Area and LA, San Francisco, and then having a statewide conference that attracted a lot of nurses across the country. And then that's what led, so one thing led to another, and that's what led to the inception of and founding of National Black Nurses Association, so not just limiting to California. And then a group of Black nurses, as I already mentioned, came together and then eventually it was incorporated and chapters were formed throughout the United States. So NBNA's mission is to be the voice of not only professional nurses, Black professional nurses, but also the diverse communities in which we live in, serve in, and play and work and other things that we do, and also help achieve health equity, advocating for nurses. Every year we have a day on Capitol Hill. That's our annual health policy day. And we continue those conversations with our legislators after that. But we put a package together of pressing health issues. So that could be diversity in the nursing workforce. That could be Black maternal health, which we really focused on this past February 1st with our legislators. Obesity epidemic, climate change and how it's affecting Black communities. So the list goes on, but we advocate for Black communities. We do a lot of health screenings. We're non-for-profit, so we provide health education, health screenings. We have a lot of partnerships with national health associations. And in addition to that, we are invested in the professional development of nurses. So as I mentioned, we have the Mini Nurse Academy, but also mentorship within our own profession of, let's say, Dr. Madison, you aspire to do something else in your career, that you're connected with nurses that are going to help you get there. And also us disseminating our knowledge and information. So through publications, writing books, scholarship service, and also we have our conference every year, National Institute, media press, just like things like this, like educating the public about our work, so it has so many areas that we address Black health and also address supporting and elevating the plane of nursing when it comes to Black nurses, because we're only overall about 8 to 10% of the medical profession. And so we want those numbers to increase. We want diversity in the workforce so that we can take care of and serve our communities that we grew up in.
That is a small percentage. I feel even more blessed to have worked with so many nurses of color.
Mm-hmm. Yeah.
What is your role and responsibility with the National Black Nurses Association?
So currently, I am the chair of the National Black Maternal Health Task Force. So Dr. Sheldon D. Fields became the president last summer, officially, last August. We have our elections at our annual institute and conference. And he formed 3 different task forces. One of them is the Black Maternal Health Task Force, and he appointed me as the chair And I lead this task force also with Dr. Lucinda Canty, who is a midwife and also a professor and a business owner of Lucinda's House. So both of us work so well together in getting this task force off the ground. And overall, the mission is aligned with MBNA's mission, but the focus of our Black Maternal Health Task Force is to address these health disparities, address, advocate legislative changes to improve maternal health throughout the United States. So we want to really improve these conditions. And in addition to that, my home chapter is the Greater New York City Black Nurses Association. I'm a founding board member. We were founded in 2017 and officially chartered in 2018. And I was the second VP at that time. I was also the social media PR chair. So I still serve in committees on the local level with our chapter with maternal health, now called Women's Health Committee, community service, and also social media. So
Wow, awesome. And so you have a conference coming up. Want to tell us all about it and the choice to make it virtual?
yes. So we have our inaugural Black Maternal Health virtual conference that is going to be on February 23rd, which is Friday, and February 24th. And the conference, so now we have a Black Maternal Health page on the MBNA website. So that's www.mbna.org, where you can access the link to register for the conference. This is open to the public. So one of our goals here is to make it accessible to anybody. So traditionally, when you see like a medical association or nurses or anything healthcare terminology, people say, well, that's not for me. We want anybody and everybody to register if you feel that you need this information. We've also made it super affordable. It's $50 for general admission. There's a tier for MBNA members, obviously as an incentive, with a lower discounted rate. But we also are sending out correspondence to nursing programs because we want nursing students, the future of our healthcare system, to be part of this dialogue and conversation, and also to get all the information they need to make a call to action so that they can transform healthcare. And so virtual is anybody can access it. And you don't have to fly, you don't have to find a hotel. You just press a button. You don't even have to turn your camera on because you're not going to be on camera. So, so you can press a button and then you can zoom in, right? So the Hoover platform also is really, really nice to navigate. All the agendas there. You can also follow up with people. So that's the other nice thing is that, Dr. Madison is speaking on this panel. I want to connect with her so I can go on LinkedIn and hopefully she will respond to my message, right? So we want to provide networking opportunities for people that you naturally gravitate towards, that you want to follow up with or partner with. And all this also, with having virtual as an option, makes it accessible to anybody really in the world. And also our long-term goal after this conference is to make this conference international.
Beautiful. I've learned so much, actually. I'm really looking forward to working with you all.
Thank you.
I am on LinkedIn. I do respond. By the hour, it's about WOVA, WHOVA.
Yeah, it's called Hoover. It's WHO, right? Like you spelled it, WHOVA.
I've been saying it wrong. I love that app. I've used it at multiple dermatology conferences, and it is perfect for networking.
And it's very user friendly too.
Yeah, great for
So
engagement.
yes.
Thank you for sharing the price.
Mhm.
Well, so since it's virtual, will there be like breakout rooms?
So we're at this is our first conference. We're keeping the agenda format pretty straightforward. So we're going to have a mixture of, lectures, PowerPoints. We may have panel discussions, and we have a different theme for day one and day two. So day one is more like setting the scene. You're going to get a real history lesson. You don't want to miss that by Dr. Canty. She is an amazing historian, and she's also a midwife. You will also receive, speeches from our legislators. Senator Cory Booker. Our keynote speaker is is Representative Alma Adams from North Carolina, and also Representative Lauren Underwood, okay, will be on day 2 for the policy talk with Dr. Harris, who is a Robert Wood Johnson Foundation Fellow for Health Policy, okay? So with our legislators supporting, in addition to that, they are also all co-sponsors of the Momnibus Act of 2023, which it was just reintroduced. Senator Kirsten Gillibrand will also be providing remarks. We just met with her during the day on Capitol Hill. So we have a lot of support. And so from policy, you'll receive that information. You also, the day 2, the theme is call to action. So we will be having panelists of variety of providers. So obstetrician, midwife, lactation consultant support, doulas, discussing perinatal collaboratives, quality improvement. In addition to that, Hear Her panel talking about listening to us in the maternal space. We have a dad doula. Okay, how many dad doulas do you see? How, you know, yeah. So providing support for partners because they go through the process too, right? So mental health we're going to touch on, resources for, for pregnant and postpartum mothers. We will also be we have honorees for the closing ceremony to honor documentary, Aftershock, and also publication, preparation for birthing, right? So we want to pay homage to those who are really going above and beyond to address maternal health issues and also provide education to people throughout the United States. So, again, it is you don't want to miss it. It's going to be
Wow,
great.
it sounds jam-packed with a lot of helpful information.
Yeah.
Didn't mention when we shared that doula episode, it actually inspired someone to start their own doula business. And so I'm
Wow.
gonna definitely send this to her. We're gonna share this with all our networks. But yeah, I'm definitely gonna be sharing it.
And we're also going to touch on technology. One of our
Oh,
task force members is going to do a presentation on technology apps that are available for pregnant and postpartum women. So that's also very helpful for those who are in that space for supporting women to say, hey, you could maybe want to sign up for this app. We really need to connect people with resources.
oh, I'm so glad you added that on. So you've told us how great this conference is and why we should attend. If you could just for the audience kind of give us an overview of the current state of maternal health when it comes to Black and Brown communities.
Yeah, so as I mentioned before, I started my maternal health journey early in my nursing career. I've been a nurse for about 17 years. Okay. And I remember when I was entering, really applying for different graduate programs, I started to dig into the research on maternal health. And at that time, I was astounded by how many women were dying each year during pregnancy or during postpartum from pregnancy related conditions, and the stark disparities between Black women in comparison to other groups. And overall, still to this day, so this is fast forwarding to now, Black women are still 3 to 4 times more likely to pass away in comparison to other groups. In addition to that, it does not discriminate against socioeconomic status or degrees or level of education, because graduate prepared, higher socioeconomic status Black women have worse outcomes than white women who don't have a high school diploma. In addition to that, 80%, so this is surveillance done at the state level, at the local level, at the federal level, and even at globally with the World Health Organization, has deemed that 80% of deaths are preventable. So despite advancements in technology over the years, has actually led to over medicalization of births. Our country has very high cesarean section rates, way higher than what's the standard for the World Health Organization as what should be reasonable. And those cesarean section rates are sometimes higher in Black communities. There are higher procedures being done. And that is associated with the postpartum complications. So, what are the top complications that you'll see? Pulmonary embolism, postpartum hemorrhage, sepsis, which is medical term for infection that can lead to death, is fatal. Also, mental health conditions, postpartum depression, psychosis, heart problems, cardiovascular disease, stroke, enlarged heart, which is cardiomyopathy. So those are some of the top reasons for death, for maternal mortality. There's also, other causes of death, which is outside of the healthcare space. That could be intimate partner violence, domestic violence, and other factors that we say pregnancy associated, meaning they were pregnant at the time, but it was not directly the cause. So that's the current state. And we are also, the other issue is that we as meaning the United States, in comparison to other industrialized nations, we have one of the worst outcomes when it comes to maternal health. We also have far less workforce providers that are available to meet the needs of the birthing populations as well as reproductive health. So we have a lot of maternity care deserts in the United States, hospital units that are closing, sometimes full hospitals that are closing, not just a unit. Access to care is an issue. And we also, with the provider availability, our workforce significantly has a shortage. Other countries who are doing much better are 5 to 6 times have 5 to 6 times more providers and less barriers to care. So healthcare insurance covers all services. So if a woman wants to give birth in the hospital, in the birthing center, or at home and in her pool, that is covered and that is supported, and as well as doula access. Midwifery care is really essential to a critical solution to solving this crisis. Midwifery care is our history, but because of our history, midwives were driven out of birthing serving as a birthing attendant. And even though systematic changes happened to bring midwives back into the picture in the 1900s, they still only represent maybe about 10% of births that occur as far as attending. In addition to that, only a couple percentage of that are Black midwives, when Black midwives was our history. Is our history. So midwives in other countries are in abundance. In the countries that are doing better, people have the option to either go to obstetrician or midwife. They can go to either one. It doesn't matter. And midwives are attending the births and providing reproductive health services, which is very critical in birth outcomes as well.
Wow, certainly everything you said could be a whole topic, a whole show by itself.
Yes, absolutely.
And I love how nurses are at the center of this. So when we start to real quick, what do you think is related to that provider shortage in maternal health?
A lot of complications with, school is expensive. So some of the barriers is definitely, access to education. So that's one of the reasons why we, like I mentioned before, with the National Black Nurses Association, we have a mini nurse academy. We also provide thousands of dollars in scholarships to nursing students. We have to have pipelines. We have to provide support. Our communities are still disenfranchised in so many ways. And so it's easier to say, well, people can just pick themselves up from the bootstraps and just go to school and pursue their education and pay all the money, come out with a substantial amount of loans. But that's not really the picture here. The picture here is that we are still at a disadvantage in so many ways in our communities. So as far as diversifying the nursing workforce, we have a long ways to go with that. And that's why it's important to advocate for legislative bills that provide funding to support pipelines to medical professions, because we need not just nursing, we need more medical professionals overall and healthcare professionals, like even social work. That's there's areas where access to mental health therapy is dismal, right? Or almost non-existent. People have to travel a couple hours just to see a mental health therapist. So across the board, because again, this maternal health issue is not just in a silo. This is multifactorial. It crosses into social determinants of health, our economic status, nutrition support, access to food, access to resources, economic advantages. So it's not just healthcare. So with the provider shortage, definitely there's still a lot of barriers to education in this country.
Thank you. So, in regards to solutions, how can nurses help to improve awareness, patient outcomes, and the patient experience?
So the first thing is for nurses to continue the education. So we say continuing education in the professional world, meaning like, we're required to have these set number of hours in order to renew our licensure. But continuing education needs to be intentional. And so that's how you know. That's why it's so critical for there to be state surveillance reports, because it really gives you an idea, a picture of what's going on in your state, and also the breakdown of the issues. So one thing about nurses, we are over 4 million strong, right? We can serve anywhere. It's really important that nurses have a seat at every table, every aspect of what affects a patient. And so if we're not at the table, then we're not making the decisions. So nurses accessing, opportunities to serve on boards in the community, to serve on boards in professional organizations, to take on leadership opportunities within their healthcare institute. And it doesn't mean that everybody needs to run to be a VP of a hospital. You don't need to all have a higher level title like that, like VP or director, in order to make change. You can be involved in committee work, right? Because those committees report to those in higher administration and they listen to you, right? So being part of the change, part of the solution is the first step. Also advocating for policy. People don't understand how critical policy is. Policies are everywhere. Policies are within our institutions in which we serve patients. So nurses should always be doing quality improvement projects, looking at how we are treating our patients, our standards of care, processes for access to care for our facilities. And then there's also the healthcare policies outside of our institutes. So that's like, your state policy. So what is the scope of practice for a nurse in your state? For a nurse practitioner, what can nurse practitioners do? What can't they do in your state? Midwives, what's the current climate for that, right? And then other bills that are not professional related, like access to Medicaid, right? So advocating for Medicaid expansion, which has expanded in a lot of states to postpartum, 1 year postpartum, but there's still a lot more work that needs to be done because there's still a lot of people who are uninsured who are accessing our services, right? So nurses can get involved. We don't need to be involved with anything. Again, we're 4 million strong. But if I'm doing work in this area, Dr. Madison's doing work in another area, and we're all collectively working on maternal health issues, collectively we're strong and we are powerful. So that's what my advice would be for nurses, is to get involved, continue the education, and keep the pressure on the system. One of the issues with maternal health disparities, one of the many factors, is systemic racism and implicit bias. Those two areas need to be dismantled in order to have patients to have better experiences and that our symptoms are not ignored. A lot of these stories with women who have passed away, where their families give their accounts of what happened, or their partners, is that they had symptoms that are clearly maternal health warning signs, but they were completely ignored. And that should never happen anywhere in the world. That is inhumane to treat somebody and completely ignore their symptoms when you are a healthcare provider.
Absolutely. And thank you for providing those very specific examples on how we can continue our education. For those nurses and nurse practitioners who don't know, you can actually, besides what's ever mandatory for your state, you can personally select what those continuing education courses are. And so make sure you include maternal health when you're doing those CEs this year.
And also present at conferences.
Oh, thank you.
Not just nursing conferences. Go outside, think outside the box. Again, this is a multi-pronged issue. So go and present at another conference that's not just specific to nurses, and present your work, disseminate your information, talk about things that need to be changed in the healthcare system. A lot of the work, so given I mentioned about honoring our honorees, and one of the aspects of honoring is the documentary Aftershock. But if you're looking at the work that they're doing outside of Aftershock, they are influencing change in so many aspects of maternal health care. Some of them are, one of the dads is actually educating residents, speaking to residents about implicit bias, about his experience with losing his partner. So, we need to be in other rooms and other spaces and educating people who may not even be paying attention to this topic because they don't feel like it's important or it pertains to them. But we really need to be in those spaces as well.
Thank you. I'm glad you mentioned that. And I'm just going to put a plug in for tech as well as the financial sector, because I think a lot of times we might find that intimidating. And all you have to do is present your experience as a nurse and point to the dollars and where tech can make sense, because we can't even do our job without tech. And we don't often realize that.
And there's some nurses that have formed innovative models and have started their own apps to support birthing women. So again, like you said, they had to connect with people who are experts in tech, or we say techies, right? So merging of different fields sometimes is powerful and something that you want to do, that you're passionate about, and connecting. And so that may be you joining a business association, right? So yeah, I think we can promote that and just say, think outside the box a little bit.
I love that. I follow this doctor who talks about entrepreneurship all the time, and he does what you said. He puts himself in these rooms, and oftentimes he's the only physician.
Mm-hmm.
And that is how you get heard. But so is networking, because we can't know everything on our own.
Absolutely.
And so by networking, you learn who to talk to, where to go, how to get there, and they might even open the door for you to walk in.
Absolutely. And you allow people to be an expert and you stay in your lane.
Yeah. And if you stay there long enough, you might learn a few things.
Right. Yeah, absolutely. I've learned a lot, but I like I said before, I've served as the social media chair for the first 5 years after we founded the Greater New York City Black Nurses Association. I learned so much in being the social media chair, like just picking up on things, and people need to not be scared to learn. Because it's going to help you get from point A to point B in your career, and something that you're really passionate about. You can make a change, but just don't be scared to learn.
Oh, I love that. I love that you did social media. I'm the marketing and blog chair for diversity and dermatology, and there's a learning curve, right? But you can't ignore social media. It's free marketing. It helps us get our message out there. It helps us correct misconceptions. It helps us reach people globally. And it's just like the internet. You can't ignore it, right? And it's all about knowing how you're going to use it, right? Because everyone's going to the internet, and we might as well be there too.
Absolutely.
So how can we learn more and get involved with the National Black Nurses Association?
So on the national website, so it's www.mbna.org. You can go to the tab to locate a chapter in your area, and you can find the contact information, and you can also join via the national website. We have our own website on our chapter level. So if you're in the New York City area specifically, or we have nurses, honestly, that live upstate New York, live in Connecticut, live in Jersey, live in Pennsylvania, even some that have, started in New York City but moved down south, have remained a member. I'm a lifetime member of MBNA, so that's another option to become a lifetime member. But all of the applications are on our website. So you would just go to our Greater New York City Black Nurse Association. You can Google us or just go to www.gnycbna.org. We also are on all social media platforms. So we're on, LinkedIn, we're on Instagram, X, not formerly Twitter, and Facebook. And so if, again, you just go to the MBNA website, locate your chapter, and then reach out via their information. So some people may not have a website for their chapter, which is fine, but they'll have contact information. And also on the national website, there's a contact number to speak to the national team at the office headquarters. So if you have any questions, but yeah, and when you join us, if you want to join our chapter, get involved with our committees. That's how you get started. Come to our events, meet us. And we also have chapter meetings every other month. So it's convenient,
Yeah, getting involved is really how you get your return on your investment.
Yeah, absolutely.
That's really how you get your money's worth.
Let me tell you, if we can write testimonies from people who join our chapter and where we are now, priceless. There's no dollar amount to put on it. There's just really not. I mean, to gain a nurse family, there's no dollar amount for that.
Oh, that was so lovely. Are you guys not on TikTok?
So some members individually are on TikTok. I'm not on TikTok because for a lot of reasons. I think that, to learn another app and also time consuming. That's the part.
I can help you with that. But you mentioned all the ones that the NBNA were on. I noticed you didn't say TikTok.
So again, individual members are on it. So they do sometimes share videos and sometimes we repost it on our social media accounts. But as far as someone designated to TikTok for GNYC, we haven't gotten to that point. But I know the influence there. It's just a matter of time and
I got you. Yeah. Well, thank you so much. We'll put all the information that you mentioned today, especially how to join and how to register for the conference in our description box. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments. Let us know if we've missed anything today. Please share the show with your friends. Rate the Apple and Spotify podcast. It really helps the show get more support, and it gets the message out there to those who need to hear it. You can find us on all our social media links. We'll put that list in the description box and any of the things that we brought up today. We release a new show normally every week on TMI Tuesdays at 10 a.m. This is a special show, and with the urgency of the conference, this is going to go out on Thursday at 10 a.m. on YouTube and all your favorite podcast apps. And we're on LinkedIn too. We air things on LinkedIn also.
LinkedIn has such a long reach, by the way.
Yeah, I love LinkedIn. Follow, like, share content with all your friends. Thank you again, Dr. Barnes. Thank you for the work that you have done in nursing for our community, and especially the commitment that you have done for leading up to this conference and how you're speaking for the voiceless in a lot of ways. And I know that your work is going to continue, and we thank you for being Black history in the making.
Thank you. I appreciate your time, Dr. Madison. Thank you so much for this opportunity to speak.
Oh, it's our pleasure. Thank you again, everyone. Thank you for watching. We'll see you next time.